If Congress cannot agree on a spending bill by Friday and the government is forced to shut down, it could have an impact on health care programs that benefit tens of thousands of people. The programs allow patients to get the medical treatment they need at home rather than in the hospital, but they rely on reimbursements from Medicare and Medicaid, which could be disrupted. Mark Strassmann has tonight's Eye on America.
What's old is new again in Boston healthcare.
Hi there.
House calls by nurse paramedic Ben Coburn.
Let's have you try it out.
We tagged along as he treated James Edwards, a 57-year-old patient with congestive heart failure, encouraged by the hospital to recover at home from shortness of breath.
I've seen the nurse twice a day, every day that I've been out of the hospital.
And you have monitoring equipment?
Yes.
So if there was an issue, they would hear about it at the hospital?
Yes.
Coburn goes house to house, patient to patient.
Check your temperature here.
Part of a mobile medical program growing nationally to treat patients at home. Medicare, Medicaid, and some private insurance carriers pay for it. Nationally, there are more than 380 approved hospital-at-home programs in 39 states. In overcrowded hospitals, those programs can help free up needed beds, a chronic issue in facilities such as Mass General Brigham.
The whole idea of home hospital is that you're making the patient the center of care.
Why go to the hospital when the hospital can come to you?
Basically, yeah.
When you first started this, was it hard sell?
Dr. Stephen Dorner directs the home hospital program at Mass General Brigham. This kind of home care is voluntary, and the program treated nearly 3,000 patients last year.
Patient outcomes are at least as good?
They're better. Patients have lower 30-day readmissions. They have lower rates of complications. Lower rates of mortality.
I'm glad that you're feeling so much better.
Why is that? Personal care in a familiar setting and mind-body connection. Dr. Lauren Doktorov's treating Frank Storis for a urinary tract infection.
If you feel more comfortable and are less anxious and are sleeping better, you're going to recover faster and better.
The number one goal is to get better.
Absolutely.
And have you?
Yes, I'm probably better now than I was 20 years ago.
Critics such as National Nurses United, America's largest union for registered nurses, raise concerns about continuity and quality of care and cost. But if Congress lets Medicare and Medicaid payments for the program lapse, Dorner says patient care could suffer.
It's a critical part of the answer to overcrowding. We would much rather meet patients where they are in their homes than in the hallways of our emergency department. We know that it's not the best way to receive care.
James Edwards spent 8 days recovering at home rather than in a hospital bed.
I have my dog here, I have my friends, and I have the nursing staff that comes over and sees me.
You get the best of both worlds.
Yeah, I really do.
Not bad, huh?
Hospital care in 2025. It can be a homecoming. For Eye on America, Mark Strassmann in Boston.